Hello, my name is Nick Sanders,
And I'm Kristen Sanders,
and this is our presentation for our community health class on the nurse and the role of community health.
which is the dialysis nurse. The primary activities of a dialysis nurse, usually they see patients primarily in end stage of kidney disease, which also is called stage 5 renal disease. And it's a subset of nephrology nursing, so sometimes they do see patients in other stages of kidney disease, and sometimes they just see patients in an acute setting. Typically, they attach equipment for both hemodialysis and peritoneal dialysis, and they monitor patients throughout the procedure, which includes taking their vitals before and after, and recording anything that could be irregular with the treatment. The scope of practice does overlap with nephrology nursing because it is a subset of nephrology nursing. And they take care of patients in every stage of renal disease, acute and chronic, because they recognize that as a growing crisis, and they dedicate themselves to advocate for the patients and provide direct care and education. They can also be the direct caregiver, educator, coordinator, consultant, administrator, and researcher. The necessary skills also overlap with the necessary the activities, because necessary skills include those of med-surg nurses, which includes putting in IVs, administering medications, checking the insertion points with the dialysis machines, both peritoneal and hemo, and dressing the sites after and taking care of the patient before and after. Additional skills include educating the patients and family about dialysis and their disease process. They oversee the dialysis machines from beginning to finish, including priming the dialyzer and blood lines, as well, and also checking the fistulas if the patient has a fistula for patency and a palpable thrill. They provide pre- and post-procedural care to patients on dialysis because it can be very stressful and tiring, and some patients are very sick when they are on it. They will develop training plans with and for patients, especially with peritoneal, because it's done at home, because it's usually done 4 to 6 times a day. So the patient and their families get involved, and they like to be involved, especially with something that's so done on a daily basis. They also collect blood work every time to monitor levels, because the dialysis machines, typically, especially hemodialysis, will take out a lot of things. So a lot of their medications include additional binders, enzymes, supplements, and the like to replace what was taken out by the hemodialysis machine.
So, dialysis nursing, as far as formal education goes, you can either start with just an associate's degree, or you either go up to like a bachelor's or even a master's degree in the area. But obviously, getting like a bachelor's degree opens up more employment opportunities, and is linked with improved patient outcomes. And even certain certifications require a bachelor's degree if you wanted to pursue those. Certification is done through the Nephrology Nursing Certification Committee, and there's 2 primary certifications available within for the dialysis nurse. Those are the Certified Nephrology Nurse and the Certified Dialysis Nurse. So the Certified Dialysis Nurse focuses more primarily on dialysis, either hemodialysis or peritoneal dialysis, and it requires 2,000 hours working within the field. And obviously there's a certification process involved with that. And then there's the Certified Nephrology Nurse, which is a more general, like providing care for patients with kidney issues in general. And that requires 3,000 hours working within the field, specifically within nephrology. and 750 of those hours have to be working with either peritoneal dialysis, hemodialysis, kidney transplant, anything like that. And so dialysis nurses can expect to work in several different settings. Those settings can include hospitals, dialysis centers, physician offices, nursing homes, hospice, and home health. Within those settings, you're going to run into a variety of other healthcare professionals that you'll collaborate with. Obviously, physicians and physician assistants and nursing practitioners will help be guiding patient care and planning. Dietitians, it's an important part of managing care for a patient suffering from chronic kidney disease. Dialysis technicians who are going to help operate the dialysis machines. Transplant teams, you're going to have people with kidney failure so bad they're going to need to replace transplant. You'll be working with them to help either organize, manage the donor list or advocating for your patient. And social workers, as she said, you can be certain patients will be going to hemodialysis, which you have to go into a center, and that can be several times a week. And many of these patients, they're going to be either like disabled, and they're going to need help managing transportation. With kidney disease being such a life-changing situation for these patients, there's going to be certain teaching and learning that's going to be involved with that. Dialysis can become a daily necessity for many, and that involves diet changes, which can include limiting your water intake and reducing sodium, phosphorus, and potassium intake. Along with managing how you take your supplements, because dialysis can strip patients of a lot of nutrients, and you'll have to manage how you take your medications. If you take your medications right before you go on the dialysis, a lot of those can get booted out of your system. So there's education as far as that goes. And a lot of these patients are going to be tired or exhausted from both the disease process and through constantly having to manage their disease. So education requires patience, and can require repetition on the nurse's part. And so you can either provide written material, you can do demonstrations, and to help ensure that the patients retain this information, you can have them return both those skills and information back to you, to ensure that they're maintaining that, or retaining rather.
So according to the University of California, San Francisco, there are 750,000 cases of kidney failure in the United States, with over 100,000 of those on the transplant list and only 21,000 available as of 2017. With the need for kidney transplants rising 8% per year, the need for dialysis nursing also tends to be rising, because without dialysis, the patient would obviously perish. And
so this increasing need kind of demonstrates the need for both more dialysis nurses in the field, and also helps kind of reinforce that nurses need to be out there educating people, general population on how to manage these risk factors that are involved with acute kidney disease, such as hypertension,
diabetes type 1 and 2, heart disease, and even chronic pyelonephritis, and drug use.
And acute incidences such as like during pregnancies.
Preeclampsia, HELLP syndrome. Those can also damage kidneys if left alone for too long by the obstetricians or the patient themselves.
All right, well, that concludes our presentation on dialysis nursing. So I appreciate your time, and have a good day.
Yep, thank you.